All right, Dr. Theodore Henderson with Near-Luminance. Today, we're going to talk about depression. And in particular, I want to focus on what's going on in the brain when you have depression. I've talked in the past about the fact that psychiatric diagnoses basically are made up by a committee. The American Psychiatric Association sits down and they come up with these criteria and they say, that's how you know you have depression, because you're sad and you have suicidal ideation and you have either increased or decreased appetite, blah, blah, blah. So, I mean, again, it's sort of a mixed bag. But what's going on in the brain in depression can be very, very different from one person to another. And that's where functional brain scans come in. In particular, the one type of functional brain scan that's accessible is a SPECT scan, single photon emission computed tomography. Now, there are functional MRIs, they're not available. There are PET scans, largely not available. But SPECT scans are available, they are affordable, and they are well understood. I've spent almost 20 years working with SPECT scans. I've looked at hundreds of thousands of SPECT scans. I published on over 100,000 SPECT scans, the data of over 100,000 SPECT scans. So when you look at what's going on in the brain with a SPECT scan, in depression, you see a couple of different things. So for example, in some people, their frontal lobes shut down. They're not working. They're not working very well. They can't concentrate. They can't think things through. And you can see that in the SPECT scan. The frontal lobes will be shut down. In others, the frontal lobes will be overactive, and particularly the anterior cingulate will be way overactive. Now, that actually comes in two different flavors. There can be people who have way overactive cortexes, and their thalamus, which is deep inside, it's sort of grand central station of the brain. Everything goes through the thalamus. But the thalamus can be balanced or it can be unbalanced. And when the thalamus is unbalanced and the cortex is overactive, that's a very strong clue for bipolar disorder. And we published on that repeatedly. If the thalamus is balanced and the cortex is overactive, that's a type of what we call unipolar depression, non-bipolar depression. And then, of course, there can be other reasons that someone has depression. For example, traumatic brain injury increases the likelihood that you'll have depression in the subsequent year fivefold. So if you look at their brain and you see evidence of a traumatic brain injury, that means the treatment for depression is going to be different. In addition, the brain can be infected. Now, infected? Doc, what are you talking about? I mean, wouldn't you be in the hospital, in the ICU? No, there's now clear evidence that people can walk around with chronic viral or, in some cases, bacterial infections, such as Lyme disease, for years and not show fulminant, really, really bad symptoms, but they can be depressed, they can have problems regulating their mood, they can have problems thinking. And so, that looks different on a brain scan. So there's a lot of different ways that we can see depression and understand better what's causing the depression with functional brain scans. All right, enough geeking out on brain scans for one day. Dr. Theodore Henderson signing off.